You should bear with me, please.
Mpachanye she. That's it.
Okay, Miss Medase. Okay, my main share me screen answer na. That's it. Okay, sir. Okay. But you move the.
Mpachanye bas. But me
Okay.
and lunch no na aye ehone.
Okay.
Yes.
Very
Okay.
good.
Yo. Okay. Yo. And yeah. Medical ada friends a health group yi mu mpanyinfo nyinaa ase. Nkanka me ankasa madamfo kwesi Boateng a me ne no wɔ adwuma mu wɔ MRI ɔno na wama saa akonnwa kɛse wei aba nti meda no ase bebree wɔ saa akonnwa mu sɛdeɛ wokaeɛ no medin de George Mfibrobe nkyekyɛmu kakra a ɛwɔ mu ne sɛ menyɛ medical doctor meyɛ a clinical scientist laboratory scientist nti no nimdeɛ a meba bɛkyerɛ yi bebree na ɛwɔ laboratory side of things sɛdeɛ yɛsi hu nneɔma wohwɛ mu paa nkalabofoɔ no yɛn nea ɛnim nneɛma a ɛkɔ so wɔ nipa wedeɛ mu ne nneɛma a yareɛ a ɛka nipa because yɛn nea ɛhu yɛnya samples ɛna samples no yɛtumi hwehwɛ mu na yɛama doctors no a wɔhwɛ patients no information no na wɔn relay na wɔn aka akyerɛ patients no sɛ sei ne sei na ɛrekɔ nti no na me nua no ne me di nkɔmmɔ no na mesusu sɛ ɛbɛhu bɛhia sɛ ɛbɛhwɛ saa nneɛma wɔ ɛho nsɛm ne aka nti no sɛ nyame nkyɛn adeɛ mewɔ 3 slots ɛwɔ this month yi mu nti no I'll try my best to try and put everything together to cover everything throughout the 3 slots na mewɔ no nti and then me person me focusing on so I would say that I want to give a background to clinical diagnosis and management of diseases. So I want to talk first about the NHS we have access to health, our rights and responsibilities within this access. I want to as individuals. So throughout this talk, yeah, I'll talk about the NHS. I'll talk about the services that they offer, the access we have to this health, our rights, and then responsibilities as far as health is concerned, and then also the responsibilities of caregivers. Then I'll talk about the clinical diagnosis and management. I've named it part one to talk about the laboratory point of view, as I mentioned earlier. And then I'll also talk about the role of, into me finds, I'll give an overview of the role of the pathology, of what we do in clinical pathology as far as, diagnosis and management of patients is concerned. I think that I'll mention a few things, but at the moment, yeah, I think, okay, yeah, I'm controlling this, right? Okay, so let's talk about the NHS. We all know the NHS, but I thought that it would be good for us to know a few things about the NHS to set the background for our talk today. So we all know that the NHS is the main health care provider in this country, and then it's at the center of the provision of healthcare, in the sense that we say so we can call GP ho. The GP is under the NHS is the primary care, and then they would then refer you to a hospital if you need to be seen further. And then when you go to the hospital and there are further, things to be done, then they'll also refer you to specialist units. So NHS is at the center of, the care that is provided. And it was quite astonishing to know that it is the biggest employer in Europe and also even in the world, it's the largest employer as far as skilled professionals are concerned. And as at the end of last year, the NHS employs 1.9 million people across UK, and 1.3 million alone are in England. This is quite a staggering difference, analysis or statistics about our NHS. So it said that 1 in 25, working age adult groups, 1 in 25 of them work in the NHS. So when you meet 25 people on the street, who are in the working age group, one of them might be working in the NHS. And also quite astonishing to know that three-quarters of the NHS staff are women. And I think we know the reason why traditionally most nurses are women, and then some other offense services are provided, by females in the NHS. Okay, so I want to talk a bit about the main services the NHS provide. Into NHS, service ben omuma. As I mentioned earlier, the first point of care, the GP surgeries. They are the first point of care. And then, so they are the primary care, then followed by, the urgent and emergency care, which is the main hospitals and all that. So the other services the NHS provide include the pharmacy and then, the dentist. And these are all, you can call them like, primary cares. Um, then we have the emergency care when, you have serious issues that need to be referred. And then we have the specialized services. Notably, we know we have the cancer units in Manchester has the Christie, which is a major cancer center. And then also in the south, I think somewhere around Sutton, we have Royal Marsden. They deal with like serious cancer issues. They are more like specialized centers. And then we also have the diabetes management in the NHS, which is an established, unit. And then mental health. The autoimmune, which is very specialized. The reason why I put this in is because I work with the vaccine evaluation unit in the microbiology department, and what we do mostly with people who have autoimmune diseases and have immunocompromised conditions. So two main centers I know we are Newcastle. And yɛfrɛ wɔn AHAS, atypical hemolytic uremic syndrome clinic. And baako nso wɔ Leeds, which is called the PNH, the paroxysmal nocturnal hemoglobinuria clinic. So these are specialized clinics that manage people with chronic conditions like autoimmune diseases which have been inherited, and so they are on special treatment and all that. So these are some of the specialized units. And then we also have the your friends other services like the blood donation. The reason why I brought in this is because blood donation and sickle cell thalassemia is because um, most of these hemoglobinopathies, that affects people from Africa and also Southeast Asia and then the Mediterranean. And so these are services that we should be familiar with, so that when we have anybody, I don't know being communal say, oh, me will be all sickle cell and all that. Try and make sure that they are able to access blood donation and things like that, because they are for us to assess. And then there's also the organ donation center, and then research. I think some of us might have received maybe how do you call it certain documents or certain things in the post asking us to register with all these organizations, which is very important. If you have the means, just do it. Ask questions and then join them, and then try and offer the help that you can. The other thing, me person may come want some research, which is very, very important. The reason why I want to talk about research is that when we had COVID, there were some lessons that were learned. So COVID by and you be brain also. And one of the things was the fact that your friends say COVID killed a lot of minority ethnic, groups, especially blacks and Southeast Asians. And the reason why it killed people from this area it was such that because not much was known about what was predisposing us to COVID. So people were getting it and dying, and then we didn't know the underlying diseases and sicknesses they had. Nti, the research is very, very important. Nti, see, it is a research to be also NHS organizing research. Biana said there's a research going on trying to look for the causes of certain diseases among certain racial groups and certain groups of people. but we should be part of it because it's very, very, very important. It helps to gather information, how and helps us to draft policies and look at processes to formulate these policies into clinical diagnosis and management of patients. One of the things I'll tell you is that some of the COVID vaccines, maybe research now more the vaccines, but to say a AstraZeneca vaccine, say some of the research were done in Southern America, and the population of Southern America is not typical of the whole world. So, some people might respond differently over there, but then if you give it to other people, they would not respond the same way. It's a very important says it is a research because now information enough, especially those of us living here. The reason one of the reasons is that you know most of us were not born here, or those of us who were even born here, even though we are born here, the fact is that we are carrying genes from other parts of the world. And there are certain predispositions to us. They pertain to our race and where we come from. Into the fact that you are living in the UK doesn't mean that you are exempt from that particular thing. No, if it is diabetes, you get diabetes. If it is high blood pressure, you get it. And we need a lot of people to be part of research to help us to get a lot of information so that we can actually put these things in place, to help treat our own folks. Okay, let me go to the next one. Okay. Then access to the next I want to talk about is access to health. So before I talked about this access to health, I've seen a comment in the chat. I just want to quickly address that. My brother was saying that I should say a little bit about myself. Okay, I think I mentioned a few things that I'm not a clinician. So most of the ideas I'm going to bring out are I'll be biased from the laboratory point of view. So I was trained as a biomedical scientist from the beginning in microbiology, but now I'm a clinical scientist. And clinical scientists are I don't know how to put it. So we work hand in hand with the biomedical scientists and then the doctors, and then we help to interpret laboratory results to the doctors and make recommendations for treatment and all that. So these are options, in the health sector people can explore into. If anybody is interested in that area, you can get in touch with me through my brother Kwesi, and then we can talk about it. There are a lot of opportunities in the health sector, which and things are evolving at the moment. So there are a lot of opportunities, and people can explore them. So let us do well to make ourselves available for some of these things. It will help us to develop professionally and then even as individuals. Yeah, so back to access to health. So the most important thing to mention here is that anybody who is legitimate in this country can access healthcare because we pay towards it, both primary and emergency care. Nti sɛ wote kurom hɔ a na obi biara yɛ okay a me. Even if you are here, na sɛ onneɛma nkora mpo ɛnyɛ okay a you can access emergency care. So we should bear this in mind. Obi wɔ hɔ a na wanya yɛfrɛ nsɛn ɔwɔ afiri bi a Ghana anaa baabi or on a visit visa, and then they think that the person cannot access healthcare. No, they can. They can actually access emergency care. Nti sɛ mefa sɛ biribi nyame fa samba but biribi atu nipa kono. Now it is something that you need to immediately go to the hospital. Don't waste time. Anybody who is here on any immigration status can access emergency care. So we should not say that you register no into your health insurance into sign to me funding hospital. Please let us do well to give them the care that they need. And then also we should bear in mind that some of the services that the NHS provides can be charged, or we need to pay for them, like dental, pharmacy, and then sometimes the optical services. Okay. I see main country no more, many. Okay. Yeah. The person Misaka to also a right responsibilities. First and foremost, me person me care about caregivers, doctors, nurses, and then all the other healthcare providers. So this is something we have to bear in mind, that they have responsibility to give us good clinical care. Nti no, so oko hospital a ɛnyɛ deɛ de bɛma obiara na wobɛyɛ dɛ wobɛsum sɛ bia ɛka sɛ oh wokɔ ne yɛka sɛ service sei ne ɛwɔ hɔ a, you have the right to demand that yɛmma wo the right service, because it's their responsibility. Me say my responsibility says in confirm a patients I'm sure mu nyinaa no ɛnneɛma a ɛmu hia na sɛ mede ma wɔn within my professional boundaries and also the boundaries of the NHS. And you know, you cannot give services to anybody without their consent. You know, say oko hospital near per se you do bibi mu a, don't just accept it. Ask questions. Make sure that you be permission as an do wash him. And caregivers and so you need excuse to say, oh, I did when means you are hoshing, so mean to me can hoshi. Say you need no up to date. So the better service you be provided, no, it will be accurate and it will be befitting for the person. And doctor and also be a more care no, it is their responsibility to speak up for you so that nobody can trample upon the right you have as far as accessing health is concerned. You know, and our record so our people MIA no so na say record na up to date. And they will betting ye din kita ho ne ade na no say ethical say no kwan so like enye say you bufa so e wo kwan bia so. Ma me more example, COVID time, you know, reports be by out at Public of England and they buy out. We realized that most of the services that were given to especially minority ethnic groups were substandard, just because not much information have been gathered about us. Secondly, the people who even took us to the hospitals at the time we were in need of care, no, they didn't give much information. And also, you know, due to certain practices which are quite historical, so we don't get the things that we need. In fact, it was recorded that your friend saying some of the incubators now the amount of for oxygen I don't know. Some of them were used on people which have already been used. This is a documented issue. I'm not fabricating anything, but and these were services that were given to people, you know, from the minority ethnic groups. Indeed, there is a historical thing in this country about care. So we have to give a lot of information. Your hospital may be saying questions I say to me then I can't no here not be a no so I say to me be some questions. So these are the other side of the I don't mean person will sit time but the doctors and the caregivers they have the right to I mean it's their responsibility to use the services judiciously. But in so doing, no, ebi wɔ hɔ a memfa n sɛ wɔhu sɛ penicillin say angel into wokɔ ne sɛ ma penicillin. Try to tell them that the last time I mean penicillin no anhyɛ da ankɔ yi ama me nti no wobɛtumi ama me before anaa. You have the right to. We have the right to ask those questions, you know. And to know, even though they're supposed to manage the use of what they have, no, still we are supposed to get quality of care. And I said doctors and I said caregivers no more prioritize your safety. Into oko baby na say o safety no hu say enko yi a utumi ka ho asem. Ana omo conduct ni tisa no mo we nyina no say hu ye hu nim de. I want to me sam pese me kaka ho cultural competence. Sisi ano doctor and I say nurse and I say anybody working in healthcare or ma care bia no. Omo ntumi nka say oh me nim a friend saying ebi before ɛho nneɛma nti no menim deɛ mɛyɛ ama wo daabi. The UK is very diverse and it's not been today, it's been like ages ago. Currently, the medical books were updated to include a lot of information about the presentation of diseases and sicknesses in other races. And so if there is a condition that appears purple in a white person, you have to find the corresponding color in a black person. You cannot use what the books have said about the white person in a black person. It doesn't fit. And also because only cultural competence now onim sa no mana sa ken obema no ho to chuma kakra. We have to watch out. Nti so near say in fact so bayare na rashi bi egu no. Na rashi na egu no. medical books no mo say is you have to look red. Now oba no kwa ho de brown. I say brown. Nipa ko no onimu a so okosua. So when to me amount the right prescription, a friends and description now, you can seek, a second opinion. And I feel so we are juma or healthcare system mo. Na say your mouth kind ma unsua dia now unko anymore. And also any clients no. Because we have is the responsibility of the caregivers to train us and to also give us, to teach us. And I feel patients, yes, you call hospital, you're right to be brave, and the medical can first, right to access quality of care. And our choice. So between you, bisa say a normal way, me per se, any say mommy and I say, Obi or be we are no a friends a recurrent sickness. And at the same treatment at the mouth, you have the right to ask for an alternative treatment. Medical informed consent was them. And I feel so we know about confidentiality and dignity and respect. And I feel so one of the things I mean who say can be before a problem can see a pan says you call hospital na sɛ yɛhu biribi ankɔ yi a yɛmpɛ sɛ yɛbɛka ho asɛm ɛduro bi na yɛde bɛma wo no yɛmfa mma wo kwan ɛkwan yɛ sɛ yɛde ma wo no so koraa wompɛ sɛ wobɛka ho asɛm but yɛkɔ hospital ɛkɔfa yareɛ ɛkɔ fie ne adeade nti no ɛbɛhu bɛhia sɛ sɛ wokɔ hospital na nneɔma bi a yɛde ma wo no ɛnkɔ yie a ɛsɛ sɛ wotumi ka ho asɛm woka ho asɛm ɛnyɛ sɛ bi a you are victimizing anybody you have the right to do so because at the end of the day no sɛ woanya yarehwɛ no a wokɔgyeeɛ no a na wokufi na ɛkɔyɛ worse na biribi kɔsi a nyame mfa sa amba but it is at your own detriment so we need to talk about it and I feel so no yes on your responsibility it's obi aba krom as wasadeɛ sɛ oba register with the GP now mostly you say you register I had information dey ma GP no sometimes it's quite scanty me fa sɛ wofiri bi a Ghana ɛba na baabi a wofiri ba biara no wonim sɛ me hypertension ma bisua me papa wa hypertension bibi saa wotwerɛ wo document saa wo sign forms na ɛsɛ wotumi twerɛ saa information nyinaa so de ɛbɛyɛ in the future no so if you have similar signs and symptoms they can then go back to your history and say that okay this person has a documented history of this nature in their family so we know what to give and all that and I feel so I say your appointment make sure that you attend your a treatment make sure you follow one of the friends and your ma is a one follow treatment especially say more antibiotics now when to me follow treatment now go see a you are likely to cause resistance the next time they say more the same antibiotics because you didn't follow the treatment plans. So these are all our responsibilities. And I'm kind of say feedback and concern. Oko hospital, no maybe unko yi so to make one sem. And yes, so show. Okay. Yanko the next thing. The next time a person make one sem to we know. I think some account who be brave, but the for us to get effective clinical diagnosis, and then management of the disease and sicknesses we have now. There are some things we should do. I've just listed 4 here. See, I also after COVID, we have a system where I guess all requests they say you want to be seen before you are seen. But I would say that insist that you want to be seen because normally be or can phone so and a phone so no. I mean, how much can you say? But the doctor has to see you and make some observations, and make clinical notes and observations. But we are in an age where, we have teleconsultations and things like that. They are not the same. Into any opportunity be ma doctor no on show na on assess it, whatever is going on. If it's something that has to be seen for a decision to be made, it's very important. So for me personally, I don't like this telephone thing because I don't think that it works. It's taking away what traditionally we know, and how consultations needs to be done. Also, maka say information I say man, it should be right and it should be thorough. And I'm obi or call hospitals GP hosts and I say be be I started 3 days ago. 3 days I started and the headache and started here. But call GP on can headache no. No, I can't be at the AC and say nam yum pa and I say nam in saba kusi yamia. But meanwhile, be a headache and start that might be the right symptom here to diagnose you. Say, clinical diagnosis, just be thorough. Because you move a percent no money be say or one for reasons I don't know. But the moment we don't have the right information about you, the wrong clinical diagnosis will be made and the wrong management will be given. and the infection might not be treated or the disease might not be treated, or it will take a longer time to treat, or it might give you complications. It's very important, say, you better the right information, detailed information, and the timelines, we should follow them. And besides, I said, we have the right to ask for options that are available to us. One of the things so Udi 40, ewo kromo say ubetumi bisa say opese yo health MOT. See the eka MOT no. Opese and you can ask. Say umepese me thorough check on my organs and all that. They can do that for you to find out what's wrong with your liver, your kidney, your heart, and things like that, whether you have high cholesterol. And that service is available to us. Into no, me pacho say unni mo bi a onya sa de ni bi da already 40 ekwa. Pacho boni koko. No mun to me enya sa because the number be beba out. You get to know that, oh, see an echo so memu and I mean that kind of thing. And it is services we have already paid for, which we all know until we have to, ask for it. Okay, so in the next few slides, and I think I've got 2 or 3 slides left. Me present my overview of what we do in the lab as far as clinical diagnosis is concerned, or clinical diagnosis of diseases is concerned. Into where we work, because we are present just many questions, we fall under clinical pathology. Into clinical pathology, no, yeah, na so doctor, ehwehwe wo die mu person who say we are ọmụ eji samples na ọmụ their brain na ya nhwehwɛmu na ama doctor mu ayɛ sɛ nipa yi yɛhwehwɛ ne mogya mu no anaasɛ sɛbe ne physics mu anaasɛ ne dwonso mu no sei ne yɛhu yɛ nti sei na yɛfi sɛ ɛyɛ no na doctor no ama information na doctor no nso ahwɛ ne books mu na ɔde te sɛ bi a friends saying management options no any treatment plans no ama wo. Into clinical pathology, no Obama, you about 5 different disciplines. And Obiani Nijuma. The first one, you're from blood sciences. The blood sciences, no. No mushe mojemu yare. Be the kind about sickle cells or any thalassemia. And as something we call thrombophilia. Thrombophilia, tibia obia ni moja infact opera moja no tumi pasa ntumi nklote blood no ntumi nklote sankofo no mo hwehwe sa no manoma ni mu na afi so moja mu cancer te sebia leukemia and lymphoma no the hematology part of clinical pathology, they deal with that, and they also deal with blood transfusion. And see, I think me organ and Mekai say it was easy for you to test your blood group and your resource factor. I have said it's quite difficult to do so. But I think when you request for all those things, your friends saying your health check, you can ask for those things to be done as well, because it's good to know. Maybe you'll be an or sickle cell or thalassemia, and they might need urgent blood. And if you know it, that is one big information you can put out there that can go a long way to help to fast track things to save the person's life. And it's our blood transfusion services when they are there to be doing all those things and blood donation and all that. And then we have a group called the clinical pathology. Pathology for almost energy so other body fluids, normally diagnosis. Diabetes, you say they can check pancreatic function to find out whether your pancreas is able to produce insulin, your liver, whether your liver is able to detoxify the things that go into your body and things like that, or kidney, any wakuma, any friends, electrolyte balance, or sodium, potassium balance near the other. Any special into some is my friends health MOT na mekaya no. Oh yeah, one of the things managing organ function test way, and then also this markers, no. So you get to know whether you are prone to be atherosclerosis, be a friends saying high blood pressure, and I say calcium has calcified in your blood and things like that, which will cause high blood pressure and all some of these things, and our kidney function, your creatinine, and all that are not working, and all those things. So it's high or low, and your liver enzymes, into for instance, we liver enzymes now almost on enzymes was so near and no so all doctor so more draw they can see that okay, your liver function is not very good. So there are certain options to the drug that they want to give you, they can then take that option. And that's how bit no more drug be so you know liver function near mouse how a drone a bit to me would liver and to mean detoxify not and so akọkọfa yare aba nti saa emoji we no ehia pa e be boa wo ma wahu no ma ekoso e wo video mu so de be ya obeda wo ho so. And another thing that we friends and pathology for so chemical pathology for so to look into congenital and friends metabolic disorders. Obi wo ha ya wo no na when ya some disease be free now from a chroma I think during pregnancy they do some of these tests. But obi wɔ ha ne yawo no yɛde ne firi bi a Ghana na aba ne nkɔla brɛ bi a ɔnya document saa nneɛma no nti saa akwadaa bi wɔ hɔ saa na ɛbɛhia sɛ wobɛma na go through saa a friend saying health checks yi sɛdeɛ ɛbɛyɛ bɛtumi anya information about ne whether they are prone to any inborn errors of metabolism sɛdeɛ ɛbɛyɛ a biribi nkɔba mpofiri mu sɛ bi akwadaa no akɔkɔ yare na akɔkɔhwɛ mu no na ɔwɔ yare bi a ɔnya firi ne maame anaasɛ ne papa hɔ na ɛho nsunsuansoɔ no yɛtumi we'll be able to deal with. Okay, so the other people I'll talk briefly about friends and histopathology for omuna sebia or cancer to meet child body ni baby check it say oh cancer we say na yeah one answer be sa so your autopsy will be who no and almost no they provide a lot of tissue for research purposes as well. Nti ɛnoma bebree wɔ hɔ a pathology a yɛbɛtumi de ahwɛ mogya mu yareɛ honam mu yare like tissues and organs and all that. Now saying if PCR by PCR has been there. Molecular pathology now is the order of the day. Molecular microbiology, molecular biology is everywhere now. Sisiano, ye umani pass a lab sample they can go a long way to look into your system to find your friends saying Yaria AO through PCR. PCR, a friend of polymerase chain reaction. You are able to, your friend saying, be able to find out using the smallest amount of sample to when we say, oh, nipakui, or abuawe, or nividium, or HIV, or hepatitis, or BBC, that kind of thing. So now, nimdia akosoropa anti, meant na ho emma no be a for a long time before we start, working on them. The earliest you see symptoms, the quickest you move to seek help and ask questions. Other than that, obetina hosa na adina jinsemu and yamin for some so. And then the other areas are microbiology. Many questions. So microbiology, no brain area, and you share mujemu, sabiti fimu, junsomu, other body fluids. Say take swab crowd when the swab stick actually when you take be a PCR, be who be winter. Let me find a question. I mean, can't want them. Sisiano, Osha, nyoma koswa, COVID. Crampono levels of COVID infection crano and cause so to said here it was predicted. Now other viruses are competing very highly with COVID. Maybe to say a friend saying RSV, respiratory syncytial virus, influenza virus. In fact, influenza virus about papers moon and say there is your friend saying a mutant H1N2 causes severe hospitalization, severe infection and hospitalization, which is very, very alarming. In fact, this month, Yankasa Public Health are predicting say we are going to see increased cases of this. So increased cases of this winter bugs. Now, COVID is not even as bad as it used to be 3-4 years ago. But these other ones are causing hospital. In fact, some of them are even causing death, especially in the old age and all that. And it's very important that when we see signs and symptoms of some of these things, we don't sit down. We go to the hospital. If we need to take vaccination, we take the McAfee vaccination. When say before you take a vaccine, please assess yourself and make sure that there's no underlying conditions in your body that would be contraindicated. And say what the vaccine da na BBS da whether you had it might not be adverse effect, but you had maybe headache which lasted more than 2 days, 3 days. You have to mention it. there is a way to mention some of these things. Maybe in my next talk, I will bring some of these things up because as much as we want to take vaccines and take medications, most especially year before no, you need a lot of information about us. And so we go and sometimes we take some of these things blindly, not knowing what we are already sitting on, and then they become sicknesses in our bodies, which is very unfortunate. And you know, my person said, if you have any little information about your health, anything that's what your mouth be in the past and it didn't go very well, just talk about it, because some of these vaccinations have caused a lot of problems to people. Madam Fubako or COVID vaccine back for 1 year, because the body are reacted differently. Ɔno na ɛyɛ n'ati fie na ɛre nya ɛfa ɛnya ɔgye vaccine no biribi anyɛ no ɔno nkɔ akɔgye yɛ no akada ne nsɛm bebree akɔ fa asthma brɛ no akɔfa no bebree nti some of these things are there, so we just have to ask questions and then ask to be screened nti no otis sɛ research bi kɔ so a now de ho ahyɛ mu so they be more information about a certain race and certain group of people to say before no ayɛ wɔ ha say no. And then your friend saying anything about information be about what say the bear only be your channel. So no touch my your friend saying anu yentam amano. In my next talk I'll talk about things like personalized medicine. Personalized medicine is very important at the moment because we want to tailor treatment to people's need so that we can omit try and errors. So the bear young fire guinea pigs. Now your more draw into dread in my way. This is the right medicine for you, and that's going to cure your disease or sicknesses. It's very important, especially as far as vaccination is concerned. Vaccination, whether we like it or not, after COVID has become one of the biggest things. And so they are going to be pushing things here and there, but we need to know ourselves. Say the bear okoje vaccine there and kofa so any embro. Oh wow, I think thank you very much. Me da ase nti mpacho sɛ question bi wɔ hɔ a wopɛ sɛ wo bisa mpacho find out. Let me come out of this. I should stop sharing, right? Okay, that's it.
Nta Brobe yɛda wase bebree.
Then
Mama
more.
yɛnya a lot of insights ɛwɔ NHS ne nneɛma bebree mi na medi kan yɛkɔ a yɛnkasa yie yɛntumi mpushi efifiri sɛ beebi a yɛfiri ba no na yɛamfa saa tete yɛn nti yɛntumi mpushi ɔma yɛate asɛ sɛ we have to push because from experience wɔn mpushi a wonnya biribiara nti mepakyɛw sɛnea doctor kaayɛ no sɛ wowɔ asɛmmisa bi a waka bebree wowɔ asɛmmisa ɛfa nneɛma a waka no nyinaa ho biribi a ɛne no ahyia bi a anaa wowɔ ade ni experience bi a ɛne deɛ ɔkaeɛ no ɛyɛ ɛyi a mepakyɛw ɛkwan da hɔ wo type no wɔ chat no mu a mɛredi ama no ate wopagya wo nsa na wopɛ sɛ ɔkasa kora wotumi kasa straight ahead nti akonnwa no ɛda hɔ no mu saa
Nyani pa baako fresca.
But no, what's the make up?
mepakyɛw ae
Okay, that's it. Ne, and wow, the other boy in the way. Na, me pese, me bisa hika class say, on say if you ba, ayana, ya wadano, ye yisu kakra, e bi edi bi kofom, se de be ya, e bit me yedma wa ha che ni ada ni we si ntino. Na aboa ye ni ebusua wo fi ni we si. Na me pese me hu say, saa deɛ na yɛyɛ no ɔn sɛ sometime mate da ba menim sɛ ɛno korɛ deɛ a ɛsɛ ɛba saa no a ɛtumi nya nsusuansoɔ wɔ so berɛ a wɔyare a wobɛkɔ hospital no ebi aduru a yɛde bɛma wɔ no ɛtumi nya nsusuansoɔ wɔ so ɛsiane sɛ yɛamfa the right adu no anyɛ den amma wo ɛna afei nso no yɛanka no korɛ ɛyɛ wɔ awoda no korɛ ankyerɛ doctor no sɛ bi ada sɛ mmom na yɛmayi na ɛwɔka different no na ama wɔnyɛ nsusuansoɔ wɔ so na sɛ ɛte saa kwan bɛn ne ɛbɛfa so asɔlvo saa problem we see nso ɛberɛ a yɛwɔ ano si that's it.
Asɛm kɛseɛ paa mentumi hu sɛ mɛtumi ama mmuaeɛ mɛtumi ama I mean the complete explanation but me ka deɛ my next practitioner a meta ko hu no asɛm a ɔka kyerɛ me mekɔ hɔ ne hɔ for problem na ɔka kyerɛ me sɛ ɔse George deɛ meka kyerɛ no sɛ yɛn nipa yɛnyini a your body need to mean generate, to cure itself when your infections and all that it can fight. But the moment I'll be clocking 40, no, until I say life begins at 40. Actually, life starts declining at 40. The moment I'll be do 40, aircon, no, your body is not as strong as a CTNO into no the rate of regeneration of cells any ahoɔden a body no wɔde bɛ fight infection in ɛso te nkakra saa nti ɛhɔ no ɛsɛ woyɛ maintenance wɔnyɛ maintenance no a you get anything that you start declining wode wankasa wohwɛ a wodi bɛyɛ 40 ɛkɔ no a wopɛ sɛ nka sɛ wafu te sɛ medie na wopɛ sɛ wogye na ɛkɔ fam a wobɛyɛ deɛ wobɛyɛ biara it takes time. It takes time. And I think say one of the things I'm recommending is say, if I say I'm not doing what now what to me I on kata BBA now what ha legally and everything. BBA in soon who crying so bit me a swear affidavit as a sound age now go back to what it used to be. So who was our question no make a mess less over fast because and that's a pomudin side of things, In fact, and you know bit me a so and I be if you find what wage so be 5 years. The moment I'll be clocking some age, now you be uncle that time, it'll be very difficult. Of course, maybe because do side age, Mammy for when you see our first part like prostate cancer, chroma say or more age limit out, which me request a test. And that age limit, it was based on test I abrofo, like almost the abrofo yes, I research, Into no sa age no me recommend but see man bibi bi oba BBC but me companies am at age so because in African men we start manifesting prostate cancer earlier than the whites into sisi ano that is age so about 55 years nka first time 60 years near that into you can go and request for it into can you imagine say when 60 years or me say 55 now to 50 years now of course request it because when science is you're having urine retention and then you are having a lot of problems with urination you can say oh age you have to go and pay private and do it which might cost you in fact a can be a fast so obetumi assistance and your money so obetumi fast so who be here because the answer certain cutoffs for certain diseases and services now access I'm sure wonya ho kwan enkwa asese na akọfa nsem bebraba mpacho metumi answer question kakra
But try that's it.
That's it.
Because me wadamfo bi wa ha no automatic into on kokra like bibi en kon ko be pa the kokra do no still that enya dwuma nti be hu ya so okokra.
And I make in fact who be here say because you see before see so one kasa to where you boni a crew man say net here one kasa if you say the be be I mean okay ma but and yes the more you ask questions the more you give information the more you get help in pamucho ebe who be here pa say you be to me ebisa questions na it to me am more information so
That's it. But also be was in Bisabi ma put me ekasa. Mpachona na usu.
No, I can't remove too much. I mean, this my request several times in my GP, and so I sat now. MOT no, on when you're home. I'm doing how many tears. The minimum advice, which we get. Yes.
But I say also me see Eddie Kakaya no are you all right within the NHS friends saying policies procedures and laws everybody you equal access so far as you are legitimate you fall within the age group you have the right Into bit maybe said the reason why young person by amount normal reason, and then you can request. In fact, you can even request to go and see somebody else because you have the right to make that request. And yet, say GP back but say on your mawa, you can choose to even register with another GP and then ask that you want that to be done. You can even forward it to friends saying the people in charge of the health services. You can go to your council. You can take it further because you are not supposed to be denied that under the NHS laws and health laws. Everybody will have equal access. Obi ni bi enchen bi. GPs ni bi wɔ hɔ a I know matete sɛ ebi mu yɛ nneɛma bebree, but they are not supposed to. Ɔmo nni ho kwan sɛ ɔmo bɛyɛ saa adeɛ no.
And that's GP for it. If I talk, Nana, I hope say one sound ye. If I just be what I say, Miss Bia, and I might be out of the one. The program no baby, yeah, Miss. But in the absence of questions, as a baby, in a baby to me say, in your bedmain. Akyerɛkyerɛ yɛn nneɛma bebree beebi a na yɛn nda koraa sɛ ɛbɛkɔ akɔfa ɔkɔhyɛ ase efiri hɔnom ɛboa yɛ adwuma fa mu ɔde afefa beebi bebree a ɛnyɛ apɔmuden ɛne topic no diagnosis ne nko ara na ɔbɛka which is very interesting nneɛma bi bebree wɔ hɔ a na yɛnim sɛnea yɛbɛyɛ no nneɛma bi bebree wɔ hɔ a na yɛnte ho hwee yɛda ase paa sɛ obie yɛn ani wɔ saa akonnwa wei ho na yɛnim sɛ yɛbɛsan yɛahyia wɔ bio nti no yɛnya ne ho ndi bye bye. Na yɛka sɛ nyame nhyira wɔn nso yɛbɛbɔ mpaeɛ na yɛgya wahyɛ nyankopɔn nsa
Amen.
na atades health and rich sports ne nso so yɛwɔ the personal ministry prayer for personal ministry for take over ne ayɛ bible studies nti obi a ɔwɔ akonnwa so betumi atwɛn biara no ɔntwɛn na yɛne no nsa nkyerɛ nyame asɛm yɛhu sɛ yɛnya nnuanom bi a wɔba bɛsra yɛn sister mariana mokwando ne there are others on there a mo ne yɛn ɛbɛjoin ne yɛ ɛbɛsuasua deɛ yɛde mo nyinaa mo ase na we are saying say every Sunday biara 6:45 yɛyɛ health sports ɛfa angle biara ɛfa adwuma ho ɛfa finance because health as we see it biribi ɛnkɔ yie wɔ another part of your life it still affects your health because health is not just yare a ɛyɛ o adwene mu whatever you think it's part of your health and so we make sure say health and rich we go to all angles and we are inviting everyone invite your friends mama ahofoɔ onamfofoɔ ebusuafoɔ beebi a ɔmo wɔ obiara yɛ welcome to join yɛda ase paa enua bɛrima brobe dr brobe nyame nhyira wo saa mmerɛ yɛbɛfrɛ yɛn elder emmanuel yɛboa na wabɔ mpaeɛ de akyira so de apɔn yɛn for the health sport no na wɔbɔ mpaeɛ no nso ɛda mpatwa na wakae dr brobe sɛ nyankopɔn ɛma no nimdeɛ na daa ne daa nyinaa ɔnhyira no na ɔmfa bi mmɛdom yɛn nsa.
Ɔkyerɛ yɛn mmɔ mpae. Yɛn agya a wɔsoro, pàtó yɛda wo ase akonnwa a wɔde adom yɛn wɔ nokwafo Yesu din mu. Papa yɛda wo ase w'akoa Brobe ɔnam nyansa a wɔde adom no ɛwɔ de adwuma a wɔde ama w'akoa nhyira nka wo din. Yɛda wo ase ɛberɛ a w'akoa nya ama w'asafo. Yɛsrɛ wo sɛ ɛberɛ baako biara a w'akoa ɛtu ne ho de yɛ nsiesie sɛ wɔde wɔbɛbɛkasa akyerɛ yɛn ɛwɔ adesua wie mu. Yɛsrɛ wo sɛ kɔ so hyira w'akoa. Tiri paa sɛ hyira wo ne na wɔde ne yere nso abusua a wɔ Ghana ne wɔn a wɔ ha nyinaa Awurade srɛ sɛ Yesu din nti hyira no. Ɛberɛ a wɔhyira wɔn ne n'abusua nyinaa kɔ so ne hyira no wɔ nyansɛm titiriw ɛwɔ saa adom akyɛdeɛ a wɔde adom no. Ma saa adom akyɛdeɛ ɛnni ho adanseɛ nkyerɛ afoforɔ. Na Awurade sɛ w'akoa biribi da n'akoma so sɛ wɔde ɔsrɛ wɔ afuo no mu a wɔde w'akoa butu a ɛyɛ a wɔde fa dom no. Na saa akwannya a wɔde ma yɛ yi ma ne nyɛ nhyira ɛmka n'abusuafoɔ nyinara. Yɛda wo ase nso mmerɛ nso adesua a ɛtoa so hyehyɛ wɔn nsa kɔ so de w'akoa nso anim na ɛkasa kyerɛ yɛn ɛnnɛ anwummere yi aberɛ a yɛhwɛ wo ma yɛtɔ so mmienu no. Yɛda wo ase Kristo din mu ne yɛasrɛ wo. Amen.
Amen. Nyame nhyira obi biara sɛ onya adagye nti saa mmerɛ megya ha sɛ yɛama personal ministry for na ɔma take over the mantle.
Yo, agyidifoɔ